Now, we just spoke about the importance of wearing masks to counter the spread of coronavirus. Well, one more reason to wear the mask is that you'll get less sick from COVID. While all doctors have been pushing universal masking as a way to stop the spread of the disease, now a study says it's likely that face masks, by blocking even some of the virus-carrying droplets that you inhale, can actually reduce your risk of falling seriously ill from COVID. This is by reducing the amount of infection that you're exposed to. According to Dr. Monica Gandhi, an infectious disease specialist at UC San Francisco, this has the potential of variolation. So what is variolation? That means you get a milder infection that protects you from a more serious infection, as we all await that vaccine. Well, to talk more about this, we're now joined by Dr. Monica Gandhi, Professor of Medicine, UCSF, Associate Chief Division of HIV, Infectious Diseases and Global Medicine. Thank you for joining us on the show. First and foremost, why is it so important to wear masks to counter the pandemic?
Yes, I mean, I think it's actually one of the most important pillars of pandemic control, and there are two reasons why facial masking is so important with COVID-19. One is that it reduces transmission to yourself and to others. So by putting that cloth or surgical mask over the mouth and nose, you're preventing the virus from getting to other people, and you're preventing the virus from getting in. And then there is an increasing theory that if you do happen to get virus in through the mask, that it will decrease the severity of the disease you get, so you're more likely to get a very mild infection of COVID-19. So there are so many reasons to mask that I think it can get us through the pandemic better than we're getting through it right now.
Right. If you could explain that, in a bit more detail about this point that you have made about wearing masks helps in letting in just small amounts of the virus, and you get a milder infection, and that protects you. If you can explain that.
Yes. So you're right that we first messaged, at least in the United States, that the mask protects other people. And that's because the virus spreads at such a high rate from the mouth and nose, even when you feel well, that you can give it to other people. But actually, we think that the mask protects you very strongly as well. And not just the second reason, which I'll tell you, it also prevents transmission. In any other respiratory virus, it prevents you from getting the infection. And then the theory that we've been talking about is that even if you get the infection, you're less likely to get a bad infection. And what I mean by that is masks block out the majority of viral particles, but they don't actually block out all of them, especially a cloth or a surgical mask. There may be some viral particles that get in. If you get infected, there is a lot of data from animal models, even with this virus, that the less virus you see, the less likely you are to get sick. You're more likely to have a mild infection. And it's not just the animal models and long-standing evidence from animals, but even in the setting of what we've been seeing with COVID-19, in places that are universally masking, wearing the mask, there is a very high rate of people not getting sick, even though they get the virus. They're asymptomatic, and there's much lower rates of having bad infection or severe infection. So we call it the viral inoculum theory.
All right. So recently, the head of the U.S. Centers for Disease Control and Prevention actually said that mask is as good as a vaccine. Do you agree with that?
Yes, that was a dramatic statement in a way that Dr. Robert Redfield here in the CDC in the U.S. made on Wednesday to the Senate, that he said, I think that it is as effective as a vaccine. And I think what he means by that, and I agree with this, is that we don't have a vaccine yet.
Right, right. And we're still awaiting one.
Take a while for the population to become immune from the virus with the vaccine. So to on masking for at least maybe a year until we get a safe and effective vaccine. That's what he means. And I think he's right. I mean, of course we need a vaccine, of course, and we are all eagerly awaiting, but we have to conduct those trials safely and get an effective and safe vaccine.
And finally, I'd like to ask you if you're watching the situation here in India, the way, coronavirus numbers are increasing, and what's your view of it?
Yeah, I think India is a very interesting situation in that way that it is difficult with such a dense population, especially in areas like slums in Mumbai that are hard for people to separate. It's almost I mean, it's impossible. And so because of that and other reasons, you have seen a lot of cases recently, and it's great that it's starting to level off. The the death rate from COVID-19 in India has been less than other countries or what we expected. And I know that many experts are saying, oh, we are not counting a lot of deaths, and that could be true. But I think that one reason is it could be that I do think Indians are masking, are using the mask. I will say that if anything is cheap, easy to get, easy to do, it is putting a piece of cloth over your mouth and nose. That is something that is one of the lowest cost strategies that we can think of. And if that protects people from getting severe illness, if this hypothesis is true, then that could be one reason why Indians are doing better in terms of the severity of disease. And yes, I really hope for India that things start getting better, because I know it's been a very scary couple of months.
Absolutely. Thank you so much, Dr. Monica Gandhi, for speaking to NDTV.